What are the best exercises for biceps tendonitis treatment? Biceps tendonitis is actually really more commonly an injury to the shoulder. You actually have three biceps tendons, one at the elbow and two up in the shoulder. But the most common one that's injured is the long head of the biceps up in the shoulder. I'm Dr. Dave Candy, and in this video, I'm going to explain to you some things that can cause biceps tendonitis, what the symptoms are or how to know if you have it, and what exercises that you can use to treat biceps tendonitis so you can get back to the activities you enjoy without having pain in your biceps or your shoulder. Now, if you find this video helpful, give it a like and subscribe to our channel. We help people stay active, mobile, and healthy without relying on pain medications, injections, or surgeries. So first of all, what causes biceps tendonitis in the shoulder? It's usually not so much doing things like biceps exercises. It's usually more overhead movements with your shoulder. It is more common in active people, particularly throwing athletes like baseball pitchers or people who play overhead sports like tennis or volleyball, or people who lift weights overhead. That if you use your arms over your head a lot, you're more likely to pinch the biceps tendon. Now, where does that long head of the biceps attach? It attaches at a bone on the top of your shoulder joint. It's called the supraglenoid tubercle. It's actually a part of your shoulder blade, but it sits right above the ball of the shoulder and kind of underneath a narrow little arch there. Now, that arch is at best 1 centimeter wide. If you happen to have some bone spurs in your shoulder, little hooks that come down, that can narrow the space even further. And there are a lot of things that have to run through there. There's a bursa in there, your rotator cuff tendons run through there, your biceps tendon runs up through there and attaches to your labrum. And so there are a lot of potential things that can get pinched. And when you have an impingement in that subacromial space in your shoulder, it's usually not just one thing. That it may be the biceps tendon, it may be the bursa, it may be the rotator cuff. And so you may get a lot of different diagnoses: biceps tendonitis, rotator cuff tendonitis, rotator cuff inflammation or rotator cuff tear, subacromial bursitis. Those are all different names for saying that you're pinching something up underneath the shoulder. So that's one way that the long head of the biceps, which runs up the front of the arm, can get pinched. Now, that long head of the biceps, it also has a slip that attaches into your labrum. And your labrum is like a fibrocartilage disc that makes the shoulder a little bit more stable. And you can injure that either from an arm dislocation or, again, in like throwing athletes who go back into this cocking position with their arm way back there. When your shoulder is in this position, that makes the ball kind of glide forward in the socket a little bit, and it can bump out into the biceps tendon. Now, another additional thing that can cause that biceps tendon to get irritated is if you tear the retinaculum. There's two little bumps on the ball of your shoulder, the greater tuberosity and the lesser tuberosity. And the long head of your biceps, it runs right between the two of them. Now, there's normally a ligament or a retinaculum that goes over top of that, and it keeps that bicep tendon held in place between those two bones. So you do move your arm like in a throwing motion, or if you're rotating back and forth like that, the bicep tendon moves along with those two bones, and it doesn't get irritated. Now, if you feel a popping in your shoulder, like when you move your arm back and forth, and it happens over and over and over, perhaps it's maybe not even painful, but that's a good indication that maybe you've torn that retinaculum. And it's usually not a big deal unless it starts to give you symptoms. Now, if you're watching a video on biceps tendonitis, chances are maybe it has started to give you symptoms. So what symptoms do you get with biceps tendonitis? Well, usually it's a symptom of shoulder pain. Now, when do you get that? It's usually going back into those cocking motions like that or lifting things over your head. So what treatments do you do? That's probably ultimately why you're here, is because you want to know what treatments you use to relieve biceps tendonitis if you happen to have it. Now, the treatments for biceps tendonitis, they're not doing bicep curl exercises. It's definitely not stretching your biceps. In fact, the treatments for bicep tendonitis really have nothing at all to do with the biceps muscle itself. It usually has more to do with getting the ball centered in the socket of the shoulder, keeping that ball so it doesn't bump out into the biceps, and getting correct biomechanics when you're either throwing or when you're lifting things over your head so that you don't continue to irritate that biceps tendon over and over and over and over again. So what things does that involve? Well, that does to some extent involve strengthen your rotator cuff muscles. Your rotator cuff muscles kind of suck the ball back into the socket and help keep it stabilized in the center of a joint. If you think about a golf ball sitting on a golf tee, if that ball is centered on the tee, it moves and spins rather smoothly. But if it gets out on the edges, there's a potential of pinching things or causing some inflammation. And that's the way that both rotator cuff tendonitis as well as biceps tendonitis can occur, is if that ball gets out of the center of the socket and it starts moving in places that it shouldn't. So how do you strengthen your rotator cuff muscles? Well, I've got a whole nother video on that. The long and short of it is that it's a whole lot more than doing these type of exercises with a band or with a dumbbell. That does definitely strengthen your rotator cuff, but most people with biceps tendonitis, this isn't the motion where they have problems. It's when the arm is overhead. So either doing rotating motions when your arm is over your head, or even more specifically, just learning how to raise your arm overhead without letting that ball slip out of the socket or move abnormally. Now, I've got some more videos that specifically deal with strengthening exercises for your rotator cuff and how to improve the stability of your shoulder, perhaps if you do have a labral tear. And I'll link to those separately. But just know that the treatment that you want to use for your biceps tendonitis is not doing biceps exercises. It's not stretching your bicep. It really has more to do with increasing the stability in your joint. Now, what other exercises can you do if you have biceps tendonitis in the shoulder? Well, the biceps muscle, it not only flexes your arm like that, but it also lifts palm up that way. And so if you do have an injury to your biceps, you want to avoid lifting things with a palms up position. Now, if you lift thumbs down, that also puts your shoulder in a position where you're going to pinch the bicep tendon and potentially the rotator cuff tendons as well. So if you are lifting things, it's best to kind of keep a neutral position with your thumb up. And that may include doing arm exercises where you're raising up like that, neutrally with both thumbs up. If you do lateral raises or exercises out to the side, doing a thumbs up position as opposed to a palms in or palms down position. And when you're lifting things up, you want to avoid lifting with a palm up, especially where your elbow comes away from your body, because that puts more strain on the biceps tendon and can potentially put it at risk for further injury. So what exercises do you do if you have, say, a distal biceps tendonitis? And that's really more the area down here, in where your biceps attaches into the elbow. Now, how do you get that? It's usually from repetitive overuse, repetitive lifting, particularly lifting with your palms up like that. You can see that that tendon starts to pop out there a little bit when you do that. Now, that usually happens more in people who either do manual labor and are using their arms a lot, or in people who just, they want to get large arms and they overtrain their biceps and they get some irritation there. So how do you stop that? Well, usually it's backing down on a training volume. That if you are overtraining or using those muscles too much, you need to use them a little bit less. But you can find ways to continue to lift things with your arms without getting that bicep muscle so involved. Your bicep muscle, it not only bends your elbow, but it also raises your shoulder up, palm up specifically like that, and it also helps rotate your forearm. So it really has actions over 3 joints. And if you're dealing with tendonitis in your elbow, you can lift things in a position like this. This uses a deeper muscle in your arm called the brachialis. And that muscle, you lift more like that using the brachialis and using the brachioradialis in your forearm, but your biceps don't get as involved when you're like that. So if you're lifting things around your house and you happen to have a sore elbow like that, doing lifts like this, where you're holding things more in that position, will help minimize the involvement of your biceps. Additionally, if you're training at the gym, training with a palms down position, that almost completely shuts off the biceps, and it makes you focus more on that brachialis so that you can continue to train your arms and work on the muscles that will help take some of the load off of your biceps when you do get back to training biceps exercises. So those were a few things to help you, whether you have biceps tendonitis in the shoulder or if you have biceps tendonitis down at the elbow. Now, if you do have biceps tendonitis, specifically the shoulder, that's not something you want to self-treat, because over time, the ball can start to come more forward in the socket and potentially can even create a biceps tear, where that ligament or that tendon in your biceps, it ruptures, and it'll give you kind of like a Popeye looking arm where there's a big gap and then like a little muscle there. Usually that is not repaired surgically unless you're a high-level athlete. That because you have two heads of your biceps, most of the time surgeons will either just snip it off completely or choose not to reattach it because the recovery from just cutting it is much quicker. And if you're not going to need your arm for high-level performance, most of the time people choose not to do a reconstruction of it. So if you do need some help for biceps tendonitis to stop your shoulder pain, get back to activity, and prevent it from getting worse so that you don't end up tearing the muscle completely, then we'd love to help you. If you are in St. Louis, give us a call at More for Life, and we'd love to help you out. And if you're watching this from somewhere else in the world, but you found it helpful, give the video a like and subscribe to our channel so you can get notified of our future videos. Thanks so much for watching, and have a great day.